Hi, my name is Dr. John Paul Gallardo. I'm a periodontist here in Miami, Florida. I wanted to share with you and all of my patients how things are going here at the practice and two of the most common questions that I've been getting this week. One from colleagues, which is, as a healthcare provider, what do you recommend? What are you recommending for your patients at this time? And the second question basically from everyone is, what do you want your patients and your community to know about at this time? So as far as what I'm recommending for patients, I know that we're in a very difficult time. This coronavirus pandemic is a real thing. So having said that, what I'm recommending for patients, first of all, is to not get too low on these lows. In other words, there's such a thing as having too much fear. I think that having too much fear is a problem because it doesn't allow us to really focus on what we're in control of. And what we're in control of is, number one, our own minds, the things that we think about, and not overdoing it. Take care of yourself, your family, your team, your patients, and begin with the end in mind. I mean, this is not going to last forever. So a few months down the road, maybe the last 6 months of this year, that's going to reflect how we handled this crisis now in the first 6 months of the year. As fear goes down, our perspective on reality really does go up. And you have to make your own kind of list as to what are you going to do to make yourself and everyone around you feel better. And that's going to be something that should include a family meeting and just like we've done with our team here at the office. So I say limit negative social media, limit the amount of TV that you're watching, limit the negative people around you. We all have people that are basically just talking about how horrible things are all day long, and we don't need that. That takes our focus away from what we're supposed to be doing, what our most productive endeavors should be. Only focus on your sphere of influence. It's not your job to create the vaccine. It's not your job to keep statistics on how many people are sick. Other people have that as a job. Your focus has to be what's right in front of you. Family, family, family. Morning rituals for me is like I start my mornings at 5 a.m. for first 2 hours. I set myself up for the rest of the day. Don't make things any worse than they're supposed to be. As far as this whole situation, when it comes to the dental aspect of it, what we do is we deal with infection, we deal with pain. So we are busy, and we are busy also because other doctors' offices and dental offices are closing their doors. So what we're saying is anything that has to do with infection or pain or the risk of infection or pain during these difficult times where we want your immune system to be at its best, it's probably wise to continue treatment. And we are practicing from social distancing. We have an isolated building so we can control the outside and the inside of our sanitation protocols. So I really hope this helps. I'll keep you up to date as things progress. Right now, we're looking forward to continuing to help our patients. Don't get too high on these highs, don't get too low on the lows. Just keep it right in the middle and focus on what's most important to you. Thank you.